break or crack in the bone is called a fracture. A broken bone that does not puncture the skin is called a closed fracture. But sometimes, the bone can fracture the skin, and that is called an open fracture. Even if you can't see any blood, the break could cause some internal bleeding, and the injured person may develop shock. Bones that are still growing, like children's bones, are supple and can split, crack, or bend quite easily. A bit like a twig, but the injury is still very painful. If you think someone has a fracture, you may see swelling and bruising. They have difficulty in moving and have movement in an unnatural direction. Their limb may look shorter, twisted, or bent. There may be grating noise or feeling if the limb is moved, have loss of strength, or see signs of shock. If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place a padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure to the wound, not over the protruding bone, to control any further bleeding. Call 911 or any emergency hotline to call for help. While you're waiting for help to arrive, don't move the casualty unless they're in immediate danger. Hold the triangle bandage with the longest length vertical and hold the arrow pointing to the injured side of the body. Lay the sling over the patient's body, aligning the arrow tip with the height of the elbow. Have the patient move the injured arm across their body, then grab the bottom of the sling and fold it over the other shoulder. Fasten the sling with a knot, ensuring that the elbow is covered and is supported by the sling. A fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock, but do not raise an uninjured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, pad and support the injured area, use a sling or triangular bandage to keep it secured. Cover any wound and call emergency hotline. And that's how you treat someone with fracture.
Baby ko si kulot, inaalis ng aking lungkot. Sa mga ngiti mo ako'y parang